Early diagnosis, what checkups you need. You do first simple blood test to check they don't have a high bad cholesterol. Have a early checkup that they don't have high blood pressure because they may have no symptoms. Say with diabetes, it's a silent killer. There are people walking with HbA1c of 8, 9, 10, and they're not aware that they have the sugar problem, and that is to be addressed really early. We call this HbA1c level has to be less than 7. Same as the LDL level has to be low. And if you suppose have a stent put in, but you don't change your lifestyle, you don't treat your hypertension, you don't treat your sugar, you're going to have a new blockage. That's what can happen. You can have a stent, but there are 3 other arteries. You can get a new blockage. And you have to change your lifestyle. That's the key thing.
How do you see the
Well,
we need to upgrade our system here. We live in government hospitals, private hospitals.
I haven't visited any government hospital, but I know when I used to come to STIMS 5-10 years ago, they made a tremendous progress while watching them to grow. But I can tell you from the private sector, it's the only hospital I had an opportunity to see. And as I said earlier, I had been here for 2 days seeing patients. I just did the procedure before I came down. I'm very impressed with the facilities they have.
Thank you, sir.
Thank you.
Hospital here with all the facilities like we have in America, and they have excellent cardiologists, excellent skills. By that, people don't have to go outside J&K, they can come here and have all the facilities, particularly now in the heart disease. Heart disease is the #1 killer in the world. And they have all the facilities here. I think as a press, you need to make people aware of symptoms of heart attack, because a lot of people are dying here because of heart attack. The key thing is the early recognition of symptoms and coming to quickly and have the treatment, or we can open these blocked arteries which cause a heart attack. So I think that's all I have to say is that I'm very pleased that I'm here for 2 days, that we have a great facility here with great skilled, great experienced doctors here, which can do a lot of things as we do in America. They have all the facilities here.
You have been here in Kashmir,
So I had this dream of developing a hospital where patients who can afford to have it done, then I don't want to go to the politics.
How much medical, as far as medical facilities are concerned, how much change you have noticed it? Then and now.
Oh, tremendous change. I think the facilities are phenomenal now. I mean, I've been here for 2 days at Pars, and I'm very impressed. Much better and more facilities than when I was here 5-10 years ago.
Many young people have been died with this disease.
I think the #1 is people who smoking.
Right.
#2 is diabetes. We call the silent killer. Every 4th person in Kashmir is diabetes. Then patients with high blood pressure, and also patients with bad cholesterol level, high cholesterol, especially LDL. Patients with family history, if somebody's father, mother, brother had a heart problem, they are more likely to have the same thing. And stressful situations and not having good lifestyle, eating habits. And these are the really things which person can have and develop these blocked arteries which nurse the blood to the heart. So I think we have also learned that right from the childhood, if you give them the right food and to make early diagnosis of blood pressure, early treatment of diabetes, early treatment of high cholesterol, if you do that, you can prevent not only heart attack, you can prevent surgery, you can prevent angioplasty. Because there is so much of advance now in these early checkups, early treatment, like a car. Suppose you have a car, you get regular checkups. That's important, not to wait till something else happens. Make early checkups, early diagnosis.
No, people are using the junk food so much today in today's life.
Well, that is the number one cause then, as I said.
What precautions should we take in case of health, especially heart disease and other things like diabetic?
Well, what we have to do is, if you are diabetic, to have the right treatment at early stages. And the eating habits, exercise. If you have high blood pressure, to get early treatment. Not to wait till something happens. Same as if your cholesterol is high. We have now great drugs we call statins. They are modern medical medicines. So if you have a very high cholesterol, a bad cholesterol called LDL, you give them statins. There's a 50% reduction in heart attacks with that medicine called statins. They can even prevent new blockages if you give them early. And that's the key thing, early lifestyle changes and early treatment. And people have to be aware if they have chest pain, with shortness of breath, a pain going down the left arm, they're sweating, this could be the part of the heart attack. And they have to get early treatment for that.
So after stenting